Hi everyone. Hi, I'm so excited tonight. I'm live. We have a very lovely, lovely guest, and good to see you all here. Hi. So, yes, we are having this Q&A live with Dr. Anna Cabeca, an amazing OBGYN, an expert in women's health and hormones tonight. So I'm going to invite her to join us in a second. Have a, hi everyone. Good to see you all. Yes, so I was just saying that we're going to have live in a few minutes, and just a reminder to all of you that both Dr. Anna and myself are doctors, but not your doctors. So it's important not to ask personal questions. So we are not answering medical advices, but it's all about guidance and awareness about menopause symptoms and generally how to deal with it. So I'm going to invite Dr. Anna. In a second. So whilst we're waiting for her to join us, what are you doing tonight? Send us all the questions you have. And I received some questions in advance. So we're going to address those questions first and thereafter if time's allowed. So we're going through all the other questions. Hi, hello everyone. I hope that you had a great Monday so far. I'm just trying to invite, and I'm waiting for Dr. Anna to join us. I'm still waiting. Hi, everyone. Hi, Zara. Let me know where you're from Canada or any other part in the world. I'm just trying to accept the invite, or I'm sending invitation. As usual, some technical issues to begin with. Hi, Janet from Canada. Good to see you. Okay. Oh, hi, Dr. Anna.
Hi, how are you?
Good to meet you.
It's so good to meet you. It's good
I
to see you
know.
too.
It's great. I was so much looking forward to tonight's meeting and talk.
Me, me too. Me too. Well, thank you. Where in the world are you? Where are you
I'm in
from?
Toronto, Canada.
Nice.
Yeah,
I'm in Dallas, Texas.
great. Good. So before we dive in and jump in the questions that I received, so I would love to hear you just a short bio about yourself, introduce to those people who haven't met you, and also to let us know what was that big defining moment for you for women's health.
Yeah, so great. So I'm in Dallas, Texas. I'm from the Northeast originally, and I trained at Emory University in Atlanta, Georgia, at Emory University as a gynecologist and obstetrician. I then realized very quickly in my solo practice in southern Georgia that I didn't have enough information. So I went on to continue to study hormones, bioidentical hormones, and functional medicine and age management, longevity, and regenerative medicine and integrative medicine. So triple board certified. I've published a few books, The Hormone Fix, Keto Green 16, and Menopause. And I really work to empower women to be in charge of their health, to be the, CEO of their body or the president of their body. You are in charge. I think in modern medicine, we take that power away. And that was probably the turning point for me in my journey. I always knew I wanted to be a physician. There was never a question about that. And from an early age, from 6 years old, I was going to be a doctor. But my mom was in and out of hospitals from her 30s, and with heart disease, heart issues that are very strong in my family, heart disease and diabetes. And so at 52, she had her first cardiac surgery and cardiac bypass. And then at 67, she went under a second surgery and she passed away and never made it out of surgery. And at that time, she was on 11 prescription medications, no two of which had ever been studied in one person, let alone a postmenopausal female. And at that point, I determined to understand what happened, what went wrong, because the surgery wasn't the answer. We wasn't addressing the cause of what the problem was in my mom's case. And so that took me on a journey, really, my own personal journey and a journey around the world and studying and trying to understand, okay, how do we heal our own bodies, and so that we can thrive, so we can be those. And I'm a grandma now. My mom never had 1 year of being a grandma with my firstborn daughter. So, I mean, this is, that's the beauty. I can't wait to have more grandbabies and to enjoy them as I grow older versus to be on medication and to suffer and to struggle.
Absolutely. To be healthy, happy grandma.
Yes.
Great. Amazing. Lovely, beautiful story. Thanks for sharing with
My
us.
pleasure.
So let's dive in the question about hormones for women. So one of the main questions that I every day receive is or complaints seeing me patients talking about their doctor is not doing tests. They not check their hormone levels before starting on HRT or hormone replacement therapy, checking estrogen, progesterone. What are your thoughts on that? Do you normally do level checks before starting medication or during treatment, or no? Or what are your thoughts and recommendations?
Yeah, that's a really good question. So for me, there's a few ways I would say test them gas, but treat the patient, not the labs. So you have a couple combinations there. But one of the things, and I write about this in my first book, The Hormone Fix, it's the questionnaires. It's like being able to assess what are our questionnaires, how are you feeling? And even because so many times patients will come to me and say, Dr. Anna, they did my labs and they're normal. And it just depends how you look at those labs. Like what's normal versus optimal. I think being able to, first of all, support our body's own natural hormonal processes, so we're making and using more of our own hormone naturally, that comes through food and lifestyle and nutrition, lifestyle, thoughts, all of those things. It takes more than hormones to fix our hormones. So this is it's a really important concept. So always the nutrition, but I love to test hormones. I love to test them in every way: blood, urine, saliva, just, and I'll check a stool test and look at, other markers and factors. All of these things can affect our hormones. So I find it very important to look at hormones in a very holistic way and to address that. And then to, follow over time, but ultimately treat the patient, not the labs.
That's great. Yes. And that's the beauty of functional medicine together with conventional. So you have both sides, so many tools to use in your toolbox. Yes. Now, some woman's asking about low sex drive, libido. She's 48 and she's asking for cure or help how to boost the sex drive problem that she's experiencing. If there is a supplement, how to check it or what to do.
Yeah, it's a not an uncommon question. I mean, if you look at the New York Times a few years back, one of the best-selling the most widely read article from the New York Times Magazine was on the sexless marriage. And so I lecture on this topic a lot. You know, I love to lecture on this topic. It's so important. And it usually when it comes to a low sex drive, it comes to three things. It's issues of desire, issues of disconnect, a disconnect with a partner, and or your own body, and it's discomfort. And as we age, discomfort's is a real issue, along with the hormone changes. So it could be from dryness, and if it hurt and causing pain, discomfort, bladder infections. I just was on, coaching another client who had recurrent bladder infections and was put on daily antibiotics. It's like, okay, well, let's address the root issue to this, because daily antibiotics aren't good for any of us. And when do you stop? And then what have you done to your entire microbiome by the time you do stop? Anyway, so another story. But vaginal um, dryness can start in our 30s and 40s and causes discomfort. And if it hurts every time you do something, why would you want to? So one of the things I created was my product Jolva, which has DHEA and plant stem cells from the alpine rose plant, and it helps restore collagen, helps to penetrate the deeper layers, so it actually turns back the hand of time so that your body's producing its own natural moisture. So that's one thing. Take away the discomfort if there is any. At 48, there's dryness, the decreased lubrication, and don't be afraid of using healthy, clean, natural lubes. I like to make, and I have this on my website, a DIY lubricant. It's a combination of fractionated MCT oil and pure aloe vera gel, and combine the two makes a great lubricant. It's clean, it doesn't cake, doesn't have any chemicals in it, so it's a nice clean one. You can also use that with Jolva too. But that makes a difference. So don't be afraid there and use those good things. The second thing is adaptogens to support your body's natural hormonal production of DHEA, progesterone, testosterone, estrogen. And so I use maca a lot for that, but I never use it alone. I use it in my combination called Mighty Maca Plus, which has 30
I've
superfoods.
tried.
So it has maca.
Yeah, it's great. I
Thank
love
you. And it tastes good.
it. It does.
But guys will say, "Oh my gosh, the guys really feel the effect quickly. Their libido really can skyrocket quickly." Women are a little more complicated, but it can take a little more time and a few other things. We have to address the reasons why. I actually did a whole course called Sexual CPR on my website, and it just goes into the many areas where why we lose desire or have difficulty with orgasm, sexual function, etc. So it's a really important course to take.
Yes. Yes. Exactly as you said, there's so many different reasons, starting with relationship and going down the hormone routes. Um,
Yeah.
So someone is asking about her doctor started on birth control pills. She's again going through the change, and this was comments for regulating her periods, which were very erratic. And we know that, of course, during this time, we see some people have every 2 weeks periods, or some people skipping months and months they not have periods, so very heavy flows. I think her doctor started her on birth control, oral estrogen and progesterone in a hope to control, but now she's complaining of having not only feeling better, but worse with lower mood and low libido and lack of motivation. So she's asking for help. What can she do? This birth control pill is not helping her.
Such a good point. Again, because it's like putting a Band-Aid on it, right?
Yeah.
Yeah. So,
Mhm.
like a birth control pill, that's an estrogen, and a synthetic progestin, that's a hormone disruptor. So if we don't need it for birth control, we shouldn't be on it, and so looking at other things there. So using bioidentical hormones, progesterone is really good for the brain, and it can help us get a good night's sleep, which is good for our bodies in general. Well, people understand the connection between progesterone and estrogen and our sleep cycle, and that's critically important. So giving a synthetic progestin can cause sleep disruption too. So then you're not getting quality sleep, and it's a terrible cycle. So I don't like to use, unless I had to, for whatever reason, and very rarely, I didn't say never, have to use it in perimenopause. If I'm not, if we have other options, we want to use them first. And if I did have to use a birth control, it would only be for a short time for bleeding dysfunction to get things ready, but to get things normalized. But using bioidentical hormones can make a difference. Plus, do you have enough magnesium? You need the progesterone on board. How's your DHEA level? What's your hemoglobin A1C? Is your vitamin D over 50? Your vitamin D 25 hydroxy, is that over 50? Is your DHEAS in the adrenal marker, is in the blood, is it over 150? We want these optimal, not normal. So I think that's important. I forget the rest of the question, Vaha.
So she is having lack of motivation and low levels of libido and sex drive since the birth control pill.
Yeah, because so birth control pills suppress your body's ovarian function and suppresses your natural testosterone surge.
Like,
Testosterone is linked to dopamine for that drive and motivation, and also libido. So
yes.
birth control pills suppressing that. So I would, definitely work with a physician to find more optimal. And I would, suggest reading my book, The Hormone Fix,
Mhm.
as a guideline to get more information on the hormones and the how they work in your body.
Yes, absolutely. And you mentioned your products. So where can the ladies have access to your products and purchase them? Are they on Amazon or they can purchase somewhere else?
Yeah, so at dranna.com, so DRANNA.com. And if you just follow me at the Girlfriend Doctor, and make sure everyone's following Dr. Baharim, so we can follow you and follow me at the Girlfriend Doctor, and just follow a link to my store and information and free content. There's a lot of free content there. So
Amazing. Lots of information, useful. Now, next question. Someone is saying that she stopped her periods last year and noticed that she become forgetful with some memory problems, and she has to write things down, otherwise she forgets, and she's worried that it's beginning of dementia and she's losing her mind. So what is the reason, or how can she help herself?
yeah. So really key to look at inflammatory markers. So you really want to look at some inflammatory markers and see what's going on there. But progesterone is neuroprotective, progesterone and pregnenolone. So, for me, I use Balance Cream. It's this cream here. It's progesterone with pregnenolone and then some anti-aging ingredients. But that is neuroprotective. It can really help you get a good night's sleep. It can help with memory, brain fog. Most people say when they start using it, they say, I feel like a fog has lifted. The world went from black and white to colored again. And so, I mean, I think that's really important. And then, what else is going on causing those feelings of dementia can be we need a good night's sleep and better, progesterone, and support our DHEA, and stay away from sugar. Make sure the hemoglobin A1C is below, is as close to 5.0 as possible, definitely below 5.3. And those are a couple things where I would start.
So what was that mix that you mentioned, the compound cream? Is it progesterone and pregnenolone?
Yeah, this is progesterone and pregnenolone and tripeptide. So it has per pump 20 milligrams of progesterone and 10 milligrams of pregnenolone per pump, and you can put it on your temples, your neck, and your décolletage, so it can help with age sunspots. I'm 57 and I've been a sun worshiper for a long time. So it helps with collagen production and your skin tone.
Good. And that's your own product? That's
Yes,
hormone.
yeah, this I created so you can get it without a prescription.
Lovely. So that's over the counter.
Mhm.
That's very good. Oh, good to know. I have such horrible sleep, and I used to be a good sleeper. Again, any recommendations? And again, we know a lot of sleep problems this age. Women have night sweats, and that could be one of the reasons they wakes them up. In this case, this lady doesn't have hot flashes or night sweats. It's just as soon as she hit 50, she has problems sleeping. Uh, so what do you recommend, what she can do to help herself, or your thoughts on this?
Yeah, the hormonal changes can cause sleep disruption. It starts mid-30s because progesterone is necessary to keep tryptophan active in the body, and tryptophan converts to 5-hydroxytryptophan, which converts to melatonin, serotonin, and the melatonin. So we need that. For melatonin is our sleep hormone that helps us get a good night's sleep. So first thing, I want to optimize hormones, really support your body's natural. So for me, foundational, it's decrease sugar. For me, it's the keto green plan. So intermittent fast, lots of good alkalinizers, high protein. Make sure you're getting enough protein with each meal. And a low inflammatory diet. That's key.
Mhm.
And secondly is supporting your body's natural hormones. So using adaptogens like the Mighty Maca Plus or combination like that. And then a good night starts with a good morning. So how we start our day, what stress level we start our day with, is going to affect our physiology for the entire day. So we want to start the day, in a very peaceful way and supportive. Like don't jump out of bed and grab a cup of coffee. That increases cortisol and it definitely will affect your sleep that night. So it's interesting. And as well, a good night's sleep. So a good evening ritual starts with winding down. Instead of being in front of blue light, have blue light blockers
Mhm.
on if you have to be in front of electronics. And don't drink too much fluid after dinner, especially in the perimenopause and menopause time period, because we'll have to get up in the middle of the night to urinate. So you want to kind of fluid restrict in the evening. And then as you're winding down, using supplement, if you need to use supplementation, using the progesterone and pregnenolone, which helps you sleep.
Mhm.
Magnesium can help, and melatonin, and then again, when you're preparing for sleep, that just meditation, deep breathing, vagal breathing or box breathing you can do to help decrease stress hormones and improve relaxation. And that also has been shown scientifically to improve deep sleep. And then a cold room, 65 degrees, completely dark, or wear a eye mask so that can also help trigger a good night's sleep.
Yes.
There's so much with sleep, especially in the perimenopause, but I find that like really, addressing the habit stacking from your morning ritual to your evening ritual and hormones and supplementation all work
Yes.
really, really well together.
Yes. Absolutely. Someone is asking, are you seeing patients outside Dallas, uh, other states?
Yeah, I see patients in Dallas. I'll do initial consult virtually from anywhere in the world, but I like to follow you up, with in my practice in Dallas. So you can find information at dranna.com. So dranna.com/about. So on my website.
That's great. Thank you.
Thank you. Thanks for asking.
Now, someone is asking, do you believe checking cortisol levels? And if yes, what do you normally do if you check cortisol? I mean, I remember those days as a conventional doctor. I used to just check cortisol if I was looking and ruling out Addison's, so extreme sides of a spectrum, so Addison's or Cushing's, but and nowadays, I started checking cortisol more frequently. I don't know what are your thoughts on that, and what you normally do about.
Yeah, it's a great question. So it's part of my routine panel. a morning cortisol. But now blood cortisols are notoriously inaccurate and don't only give you one instant at the time. But if someone comes in for a blood test and their cortisol is low after like having a needle, put in their arm, I mean, that increases cortisol. Just driving to a clinic increases cortisol. If their cortisol is still low, that's definitely a red flag. But I typically do either a full day to look at their full cortisol pattern. So from rising to midday to mid-afternoon to bedtime, what does the cortisol pattern look like over the day? And the way to do that is with urinary testing, urinary metabolites, urinary hormone testing, or salivary hormone testing. So those two ways, and I often look at the cortisol curve and the pattern. Number one, I mean, we pretty much can tell through talking with a patient, this is that, what their pattern's like just by how their day is. But when a patient sees that in front of them, it really encourages changing behaviors.
Yes. Yes, to see that graph in front of them and numbers. Yes, I can see that. You're right. So someone is saying again 45 and her period is changed, of course, but she's experiencing some joint body ache, and should she take hormones, she's asking, because she's 45 and her period's changed, but she has body aches and pains. What do you think about that?
Yeah. So first thing I would do is, I mean, that sounds like inflammation, right? Inflammation. And, so I would detox. And for me, I put people through the keto green, for example, my keto green 16 detox or my hormone detox and the hormone fix. So those two books are invaluable resources. They're so important to kind of get the lifestyle, the habits, and the medicinal foods into your system to help with helping support your body's natural hormone production. And then what do we need from here? We start with with supplementation. Start with maybe vitamin C's and good, bioavailable B vitamins, methylated vitamins. We want to look at those things that we support her body as long as possible. And looking at our labs, okay, what do we need? I don't like to go blanket out with hormones because I don't want to suppress what your body's able to do. That's what we do with birth control pills. We suppress your ovaries. We reduce your body's normal function of hormone production. So want to support your body's natural ability to make hormones and also your body's natural ability to use the hormones you're making or taking. So by detoxing and clearing the receptor sites, making sure you have enough vitamin D on board and iodine on board, because that's necessary for every hormone receptor to work, and looking at these other nutrient factors that are often depleted, causing hormone disruption to begin with. But toxins are a big part. Detoxing is a big part of my practice because toxins are huge hormone disruptors. So it's nice. It's nice to see. I've had a client in my practice recently who had a very low AMH, which is anti-mullerian hormone, and she would like to conceive, but she was diagnosed as early menopause, and her AMH was really, really low, which tells you diminished ovarian reserve. Now, I always tell clients, don't give up hope. Let's support your body's ability. Let's get your body in a de-stressed state, a very loving, kind, joyful, support your hormones, support you with antioxidants and adaptogens, and her AMH increased 10x. I mean, 10 times higher than what it was. So, and it's just in 3 months. Just in 3 months, our bodies have amazing capacity to heal itself. So, I always say, it's important to look at what's causing the hormone disruption. It can just be age in our ovary. Now we're 65, and our ovaries are producing very, very little hormone. Still, will produce some testosterone, and into our into our 60s, but we can then supplement then, but let's not try to repress our body's own natural hormones too early without
That's right.
knowing why. Yeah.
That's true. Again, someone is asking about these recurrent UTIs, which is very common. We see them, and we talked earlier about this, taking antibiotics and cranberry tablets, probiotics. It hasn't helped, and she still have those symptoms of burning, urine infection, and again, what to do. And you mentioned so many different ways and supplements that you offer to treat these people with vaginal atrophy, dryness, your maca special supplement. Anything else you wanted to add on
Yeah,
for urine infections?
yeah. I think, I mean, for recurrent bladder infections, it's always like work up to 2,000 to 4,000 milligrams of vitamin C a day, a good probiotic, and use Jolva on the urethral area, on the vulvar area, even up to twice a day to help restore that tissue and improve the sphincter. And look for any food sensitivities that could be causing irritation to your bladder and work on getting your urine pH more alkaline. All of those things really, really do help that recurrent bladder infection
Yeah,
issue.
and it's very
Hmm.
common.
Very common. But
Again, someone,
doesn't have to be. I've pretty much reversed it in every single case
wow,
that I've had.
great.
Mhm.
That's a success. And then weight gain. Someone is asking weight gain around chest and belly, hit 55 and menopause. We see this again very commonly, and that's again hormone imbalances from insulin to cortisol, uh, estrogen, all of them together. So, how do you normally start? I mean, I love that keto diet detox that you offer the group. It's great. And do you want to talk a little bit about that for us?
Yeah, actually, let me show you. So, this I recommend, we're reading through Keto Green 16 and following the 16. There's two 16-day plans in here. And so it's designed with intermittent fasting and the healthy way to do keto. And all these recipes are hormone balancing. They include key ingredients like, for example, some fermented vegetables like sauerkraut or kimchi to help support gut bacteria. It includes digestive aids like doing some apple cider vinegar, adding that to your meal, including a few really good natural digestive enzymes, but everything is low sugar. These are medicinally prepared recipes. So food heals. The food can be a source of
That's it.
healing or a source of disease.
Yeah.
So, and I use, Mediterranean recipes in here, lots of good food and spices, but trying to keep it really simple. So this 16-day is designed to improve insulin sensitivity and help with modulating cortisol and increasing oxytocin. So this plan really covers that important. And the weight gain, especially in the chest and the belly, that's cortisol.
Mm-hmm.
So I have my clients always check urine pH every time they use the bathroom initially as they get started with me to see, what makes them acidic, what makes them alkaline. And pH, urine pH is a biomarker like our pulse or our blood pressure, and it changes based on stress and environment or epigenetics. So, yeah. So this is with intermittent fasting, keto green lifestyle is very, very beneficial to.
That's great. I love the book.
Thank
I read
you.
it.
Thank
I
you.
love that. Someone is asking, she's using Saxenda shots every day for losing weight. Age of 50, is it okay? Um, we see a lot of these peptides nowadays, Ozempic and all the same. So she's asking if it's okay to take this. What are your thoughts on that?
And I definitely think in the case of obesity and prediabetes and diabetes, et cetera, I mean, it's important to support you in losing weight. The issue is that we don't want the weight to return and we don't want to lose muscle. So you have to follow these plans that are supporting protein intake, supporting, intermittent fasting, supporting you nutritionally, also creating the lifestyle of improving movement and mindset are all really key to sustaining long-lasting weight loss. And when we're removing toxins, when we're releasing fat, we're removing toxins. So making sure that you have, bowel movements every day, you are on binders during this time to help you remove toxins safely, and such as charcoal or some biotoxin binders are good combinations. And that can make a huge difference. So I think in the right person for the right amount of time, it can be beneficial. But is it for everyone? No. And it can potentially have long-lasting negative side effects. Absolutely. No.
Well, great. And someone is saying, what can someone do for low cortisol and low DHEA? 41. She is 41.
Yeah, so definitely start with my book, The Hormone Fix. Supplement with Mighty Maca, vitamin C, B vitamins, so adrenal adaptogens. I would work on your 41 and you have low DHEA, low cortisol. So the combination is really very, very powerful. And we want to, like I would say, resuscitate your adrenal glands, bring them back to life as quickly as possible. So a big part of this, and we don't talk about it very much in medicine, but it's resetting your circadian rhythm, getting morning light, getting outside, getting into nature, going on, long walks, and how you think throughout the day. There's so many factors to this.
Yeah. Someone is asking about prolapse bladder. She's 60, and it's very apparently severely prolapsed. Do you recommend surgery?
Well, would have to evaluate you, and we definitely have to evaluate you. And I would pre-op, have your doctor either prescribe vaginal testosterone and DHEA, start using Jolva, and do pelvic floor exercises. You can use also jade eggs. A friend of mine created the Cooch ball, things to help increase the strength of the pelvic floor, and that can make a huge difference. And Aisha asked, what Mighty Matcha? Not matcha. Matcha is a tea, but this is Mighty Maca Plus, which is 30 superfoods that are adaptogenic that work together. We see improvements in DHEA and alkalinization with this product. So
I love using it, and I still have it every morning. And warm water, I drink it. It's so lovely, refreshing. I feel great.
Thank you. Thank you.
So we have another few minutes to wrap up. So I'm just reading some more. I'm 46 and struggling with perimenopause. Any suggestions? I think we answered questions, similar questions. So any suggestion for this lady, 46?
I would say, again, it takes more than hormones to fix your hormones, but read my book, this is another book. So this is I call it my Magnus Opus, but this I recommend all my patients read it. And typically a new patient that comes to see me in Dallas, I'll even give them a copy. This is their homework. I want them to follow the plan. I want them to take the quizzes. I want them to understand the labs I'm drawing on them, what they're, why I'm doing these testing for them. So the Hormone Fix is a great resource. It really is powerful. And then, let's see, what supplementation do we need? But oftentimes within 2-3 weeks, patients feel better without taking any hormones. They feel better than they have in years.
That's
so true. Yeah, I just love all the questions you get. Your community loves you. It's really amazing. It's so nice. They trust you. They love you. They're asking all these amazing questions. I love it.
And someone is asking, what do you think about using baking soda for pH, balancing pH?
Yeah, you can definitely do that. I have my clients, especially if they're very acidic when they're starting out, when they wake up in the morning, I have them drink, room temperature water with a squirt of lemon juice and a little bit of apple cider vinegar. And they can do a scoop of Mighty Maca and some water. And if they've been very acidic, they can do a quarter to a half a teaspoon of baking soda in water. Now, don't eat for an hour at least after you do that. It's very alkalinizing, creating bicarb. It's going to disrupt your digestive enzymes a little bit while you're while you're doing this. And you want an acidic environment when you're eating. That's why digestive enzymes create this acidity. But working on alkalinization and decreasing inflammation, I mean, it's really beneficial. We know as physicians, when a patient comes into our emergency room and they're crashing, we may give them a shot of bicarb, which is bicarbonate, which is what baking soda is, to resuscitate them and save them life, get them out of an acidic, toxic condition. So I think for short term, it can be beneficial. Don't take it away from food, not with food. And typically, as you keep working with all, I have so many suggestions in my book to improve your body's natural pH, to improve your pH so your urine pH is over 7. And again, urine pH is such an important biomarker because it tells you, if you're too stressed, if your food's too inflammatory, if you're eating food sensitivities, it can tell you so many things. So, so definitely check that. But a little bit for a short time is fine.
That's good. Very well. Any thoughts on uterine polyps? 53-year-old woman who's still cycling. Any thoughts on that?
Yeah, same thing. With uterine polyps is detoxification and using bioidentical progesterone that can help.
Great. Thank you. Very good. So I think we have to wrap it up. It was great. So much to learn from you, Dr. Anna. It's amazing. And people can have access via your website, ask questions, and you have groups, Facebook groups, and your Dr. Anna Cabeca. So if you don't mind to type it on the comment here, I can share it. It's up here. So the girlfriend, yeah, I will share it. The girlfriend doctor. That's it.
Yeah.
They keep asking. Everyone is asking, so I'm going to share, and now everyone will see it. So any questions, you can always follow Dr. Anna.
Thank you. Thank you. Well,
it was lovely meeting you.
We have to do this again.
Definitely. It's a great talk. Thanks for all this useful information and taking time to all this question.
Thank you, everyone.
Thanks
for being here.
Thanks, everyone. Have a lovely, lovely night. See you soon. Thank you. Good night. Bye. Bye-bye.